Okay, so we will discuss individual muscles in details. These muscles can come as a short note, mainly this pectoralis major can come as a short note. Okay, so pectoralis, if any of the muscle comes as short note, you have to write under 4 points: origin, insertion, nerve supply, and action. Okay, and also these muscles, nerves, vessels, important muscle nerves and vessels in a dissected area, they can be given as a OSPI question. You have to identify the structure and write the related questions. Okay. So we will discuss pectoralis major. See this green colored one in this picture. This is pectoralis major. So origin, it has 2 heads of origin, clavicular head and sternocostal head. Clavicular head from the front of the medial third of the clavicle here. This is the clavicular head from front of the medial 1/3 of the clavicle. And sternocostal head, this head is the sternocostal head from the anterior aspect of the sternum at the upper 6 costal cartilages. So sternocostal head is originating from here. Insertion. This part is the insertion of pectoralis major into the lateral lip of the bicipital group of the humerus. Okay, so this is the point of insertion. Next, what is the action? Action of pectoralis major. If it pulls from here, okay, it generally acts from the site of origin. So it will help in adduction and medial rotation of the arm, and also helps in flexion of the arm. This clavicular portion, so this movement is flexion. Okay, so clavicular head mainly helps in flexion, and this sternocostal head helps in adduction and medial rotation of the humerus. So this is function of the pectoralis major. Next we go to nerve supply. It is supplied by 2 nerves. Lateral pectoral nerve, root value is C5, C6, C7, and medial pectoral nerve, root value is C8 and T1. So lateral pectoral nerve is a branch of lateral cord of the brachial plexus. So and this medial pectoral nerve branch from medial cord of the brachial plexus. See here, after dissecting and reflecting the skin, this is the incision line has been given. Skin and superficial fascia within which the cutaneous nerve cell line and subcutaneous pad of fat. After reflection of the skin and superficial fascia, you get this muscle. This is pectoralis major muscle. Okay. After reflecting the pectoralis major muscle, you will get the pectoralis minor muscle. So here, this green colored one, this is pectoralis minor muscle. Origin is from 3rd, 4th and 5th ribs near their cartilage. These are the cartilage and these are the ribs. Insertion into the medial aspect of the coracoid process of the scapula. Okay, medial aspect of coracoid process of scapula. Action, it depresses point of shoulder. Okay, it pulls the scapula downward, so it will depress the point of the shoulder. If the scapula is fixed, and it elevates the ribs of origin. Okay, if acts from here, it will elevate the ribs. Okay. Now nerve supply is medial pectoral nerve. Okay. For pectoralis major, both the pectoral nerve, medial and lateral pectoral. For pectoralis minor, only supplied by medial pectoral nerve, branch from medial cord of brachial plexus. Root value C8 and T1. Okay. And how will you identify this medial pectoral nerve? It will pierce through the pectoralis minor muscle, and after that it will enter into the pectoralis major. Okay. That's how you identify medial pectoral nerve. And lateral pectoral nerve will pierce the clavipectoral fascia, and it will lie above this pectoralis minor in this region. And medial pectoral will pierce through the middle of this muscle and enter into the pectoralis major. Okay. See here, in this dissected part, this is pectoralis major. Okay, pectoralis major is supplied by both the pectoral nerve. Here, this one is lateral pectoral nerve. This is medial pectoral nerve. You can see medial pectoral nerve is piercing through this pectoralis minor and then entering into pectoralis major. And this lateral pectoral nerve, it is coming from above this pectoralis minor. This muscle is pectoralis minor. From above the pectoralis minor, it is coming out after piercing the clavipectoral fossa. Okay, and clavipectoral fossa is a dense connective tissue fossa. We will discuss in details. So you can see this pectoralis major is supplied by both the nerves. Pectoralis minor is supplied by this medial pectoral nerve. Next we go to subclavius muscle. This red color one, this is position of the subclavius muscle. Okay, origin is from the first costal cartilage. Here, insertion into the lower surface of the clavicle in the subclavius groove. Here is the insertion of subclavius. Action, it depresses the clavicle and steadies the bone during the movement of the shoulder girdle. Okay, what is the nerve supply? Nerve to subclavius from the roots of the brachial plexus. This is root value C5, C6. This is a nerve to subclavius is a branch from the roots of the brachial plexus. Brachial plexus has been covered till now in your lecture? No, okay. So you read the brachial plexus. It is very important for superior nerves of the superior extremity. Okay. Another important muscle lying in this region is serratus anterior. This is mainly we see tomorrow during axilla in the medial wall of the thorax, medial wall of the axilla. Okay, so this is the location of serratus anterior muscle. Origin from the outer surface of upper 8 ribs, insertion into the costal aspect of the medial border and inferior angle of the scapula. Here, this is line of insertion of the serratus anterior on the costal surface of the scapula. What is the action? It draws the scapula forward around the thoracic wall, that means hips in protrusion, and rotates the scapula. Okay, so if it pulls from here, it rotates the scapula and draws the scapula forward. Nerve supply is long thoracic nerve and root value C5, C6, C7. Next important structure, here you will get structure piercing the clavipectoral fossa is the axillary artery, branch of axillary artery, thoracoacromial artery. Okay, so here we will discuss the axillary artery in details. So there is a relation between axillary artery and pectoralis minor. Pectoralis minor muscle is dividing the artery into 3 parts. Okay, so the axillary artery is often referred to as having 3 parts, with this division based on its location relative to the pectoralis minor muscle, and which is superficial to this pectoralis minor muscle. First part of the axillary artery, it is the part of artery lying medial to the pectoralis minor. Next is second part, the part of the artery posterior to the pectoralis minor. And third part of the axillary artery, part of artery lateral to the pectoralis minor. Okay, these are the 3 parts of the axillary artery. See here, from here to here, this is known as axillary artery. From outer border, this is first rib. Okay, from what is the extent of axillary artery? From the outer border of the first rib up to the lower border of the teres major. It is continuation of the subclavian artery. Subclavian artery beyond this point, beyond the outer border of first rib, continues as the axillary artery, and from the lower border of teres major below it, here it continues as the brachial artery. Okay, these points are very important, very frequently asked in your viva, also important OSPI questions. Okay, And from here to here, this axillary artery extent is divided into three parts. This is pectoralis minor muscle. It lying over the artery. The part lying medial to this pectoralis minor, here is the first part of the axillary artery. Posterior to this pectoralis minor, this part is the second part of the axillary artery. And from here, lower margin of pectoralis minor to lower margin of teres major, this part is third part of the axillary artery. Okay. Now we have branches. First part have one branch, second part have two branch, third part has three branch. Okay. First part, from here we get superior thoracic artery. From second part, two arteries we are getting, thoracoacromial and lateral thoracic. Lateral thoracic is lying along the lower margin of pectoralis minor. And this thoracoacromial, after coming out from the second part, dividing into four branches. Okay. তুই সামনে বসে ঘুমাচ্ছিস? তোকেই বলছে, শুনছিস কিছু? Okay, so it is dividing into four branches. This is clavicular branch going towards the clavicle medially. Here is the acromial branch going to the acromial process. Here is the deltoid branch going to the deltopectoral groove. And this is pectoral branch supplying the pectoral muscles. Okay, pectoralis major and minor. So these are the four branches. Okay, we will see some of these branches in the dissected portion. And this lateral thoracic lying along the lower part of pectoralis minor. Next, from the third part of the axillary artery, three arteries are coming out. What are the three arteries? Subscapular artery, posterior circumflex humeral artery and anterior artery. These anterior and posterior circumflex humeral arteries, they are winding around the surgical neck of the humerus, lying around the surgical neck of the humerus. And along with the posterior circumflex humeral artery lies the axillary nerve, that is a branch from posterior cord of brachial plexus. Okay? Yes. না মিডিয়াল thoracic এখানে থাকবে না, ঠিক আছে? Okay, and from this circumflex scapular, it is giving two branches. One is from the subscapular artery giving two branches. Circumflex scapular. Circumflex scapular is winding round the lateral border of the scapula. You have read in between the two slips of teres minor, it was passing circumflex scapular artery. And this is thoracodorsal. Another branch is thoracodorsal artery going to supply mainly the latissimus dorsi. Lying along this thoracodorsal nerve or nerve to latissimus dorsi. That you will see tomorrow in axilla. Okay. So these are the three segments defined by the pectoralis minor muscle. First segment has one branch. Superior thoracic artery supplies first two intercostal spaces. Second segment has two branches, thoracoacromial artery, lateral thoracic artery. And third segment has three branches, subscapular artery, posterior circumflex humeral, anterior circumflex humeral. And the subscapular artery is giving two branches, circumflex scapular winding round the lateral margin of the scapula, and thoracodorsal artery lying with the nerve of same name, thoracodorsal nerve supplying the latissimus dorsi. Okay, now structures under cover of the pectoralis major. After reflecting we have cut the clavicular head and some part of the sternocostal head of the pectoralis major, and we have reflected it laterally and downward. Okay, so what structure we are getting here? Bones and cartilages. This sometimes can come as a short note. Structures under cover of the pectoralis major. This is important for your theory question. Okay. Structure under cover of pectoralis major. What are the structures? Bones and cartilages. Sternum, ribs and costal cartilages are lying beneath the pectoralis major. Fascia, one fascia is there, clavipectoral fascia, and muscles are the subclavius, pectoralis minor, serratus anterior, intercostal, and upper part of the biceps and coracobrachialis. So these are the muscles lying in undercover pectoralis major. Vessels are axillary vessels, axillary artery and vein. Nerves are the cords of brachial plexus with their branches. All those lateral pectoral, medial pectoral, you will see they are branches of those cords of the brachial plexuses. Okay. See here, this is pectoralis major, cart end of pectoralis major. This is one end, this is another end. Okay. So under cover of this muscle, you will see this whitish structure, thin white structure covering this. These are the clavipectoral fascia. Okay. Clavipectoral fascia extending from lower margin of the clavicle and it attaches at the two limbs of the subclavian groove. Okay, you have read during the bones classes. It is attached over the two limbs of the subclavian groove. Then it extends to the upper margin of pectoralis minor. See, this muscle is pectoralis minor. It enclosing the muscle, then extending downward as the suspensory ligament of axilla and attached with the axillary fascia at the floor of the axilla. Okay. So this is the extent of the clavipectoral fascia. And laterally it extends from this coracoid process. See here, this is the coracoid process of scapula from up to the costal cartilages and ribs. First, second and third costal cartilages and ribs. And this part is of the clavipectoral fascia. It is known as the axillary fascia mainly. Okay, suspensory ligament of axilla, which is going to attach to the axillary fascia. Axillary fascia is deep fascia of the axilla. Okay, forming the dome of the axilla. And see here, this is the nerve, medial pectoral nerve coming out after piercing this pectoralis minor and will enter into the pectoralis major. And above the pectoralis minor, here piercing the lateral pectoral nerve. This is thoracoacromial artery and cephalic vein. Okay, cephalic vein was lying in the deltopectoral groove and going to drain into axillary vein. Here, this thicker, large vein you can see, that is axillary vein. So, cephalic vein is going to drain into axillary vein after piercing the clavipectoral fascia. Lateral pectoral nerve coming out and thoracoacromial artery coming out and dividing into 4 branches. And also another structure coming out through the clavipectoral fascia are the lymphatic vessels, okay, connecting the infraclavicular lymph nodes with the apical group of axillary lymph nodes. But these you will not see, these are very fine branches. Lymphatic vessels are very fine and also they are looking like the fascia, white in color and looking like the fascia. So these 3 structure you will see, this cephalic vein, lateral pectoral nerve and this thoracoacromial artery, its branches and this medial pectoral nerve and the muscles you will see in the dissected part. Okay, understood? See here, this is pectoralis major has been reflected. This is medial pectoral nerve after piercing the pectoralis minor entering into the major. This is cephalic vein. Okay, cephalic vein lying in the deltopectoral groove in between the deltoid muscle and this is the cart end of pectoral muscle. So this groove is known as deltopectoral groove. Okay, after lying through this groove, entering after piercing the clavipectoral fascia and drain into the axillary vein. You have seen in previous picture. This is lateral pectoral nerve and this is thoracoacromial artery, its branches. Acromial branch, this is deltoid branch lying in the deltopectoral groove along with the cephalic vein and this is the clavicular branch going towards the clavicle and another is the pectoral branch supplying the pectoral muscle. So these are the 4 branches, deltoid branch, pectoral branch, acromial branch, clavicular branch of the thoracoacromial artery. Okay. Okay, so here also you can see this cephalic vein is going to drain into axillary vein. This is the axillary artery. From the second part, thoracoacromial artery is coming out, dividing into branches. Acromial, clavicular, pectoral, deltoid. Okay, this is pectoralis minor. Okay, pierced by the medial pectoral nerve, and here is the lateral pectoral nerve. So next we will go to clavipectoral fossa. Clavipectoral fossa is a strong sheet of connective tissue and that is attached above the clavicle, and below it splits to enclose the pectoralis minor muscle and then continues downward as the suspensory ligament of the axilla and joins the facial floor of the armpit, that is axillary fossa. See here, this green colored structure, this is clavipectoral fossa. See, this is skin. Why are you talking? Don't talk in class. Okay, so this is skin. After the skin, you will see the subcutaneous tissue. Within the subcutaneous tissue, cutaneous nerve will lie. After that, you will get the deep fossa. Deep fossa covering the pectoralis major muscle. This is pectoralis major. The deep fossa covering the pectoralis major muscle is known as pectoral fossa. Okay, and after that you will see the pectoralis minor, clavipectoral fossa, subclavius, and this is suspensory ligament of ovary, and it is joining with the deep fossa of the armpit, that is axillary fossa. Okay, so you can see the extent. Above it is enclosing the subclavius, in the middle it is enclosing the pectoralis minor, and below it is going to be attached at the deep fossa of the armpit, that is axillary fossa. Okay, and deep to the fossa like the important vessels, axillary artery, axillary vein, like this. Okay, and important nerves, cords of the brachial plexus, and other important neurovascular bundles. Okay, so you practice a schematic diagram like this. See, this is section of clavicle. Okay, this is longitudinal section. So clavipectoral fossa comes as a short note in your theory question. So that's why it is important. Clavipectoral fossa. Okay. So this is deep fossa, pectoral fossa covering the pectoralis major. This is axillary fossa, deep fossa of the axilla. This is clavipectoral fossa. Above it is attached to the two lips of the subclavian groove of the clavicle, enclosing the subclavius muscle, and this posterior lamina, it is said, sometimes going upward to be continuous with the deep cervical fossa, that is deep fossa of the neck, and extending downward, it splits to enclose in the pectoralis minor muscle, and after enclosing the muscle, it extends downward as the suspensory ligament of axilla and attached to the dome of the axillary fossa. Okay, understood? And this area here, all the structures are piercing. Cephalic vein, thoracoacromial artery, lateral pectoral nerve is piercing through this area, through this clavipectoral fossa. And this upper part of this clavipectoral fossa is thickened to form the coracoclavicular ligament. Okay, coracoclavicular ligament was connecting coracoid process of scapula to the costocoracoid. Okay, coracoid process with the costal cartilage of the first rib. It is connected by the costocoracoid ligament. So above it is attached to the clavicle, below with the axillary fossa, lateral to the coracoid process, medial to the first and second costal cartilages. Okay, this is the extent of clavipectoral fossa. So clavipectoral fossa is a thick, strong fossal sheet deep to the pectoralis major, fills the gap between the subclavius and pectoralis minor, extends superiorly from the clavicle, medially from the costochondral joint, and superolaterally from the coracoid process. It encloses two muscles, subclavius and pectoralis minor, and this fossa converges in the axilla, where it acts as a protective structure over the neurovascular structure of the axilla. It splits above to enclose the subclavius and is attached to the edges of the subclavian groove on the undersurface of the clavicle. And at the lower border of subclavius, the two layers fuse and form a well-developed band, the costocoracoid ligament. Okay, this ligament I was saying, it's costocoracoid ligament, stretching from the coracoid process to the first costochondral junction. From this ligament, the fossa stretches to the upper border of pectoralis minor, where it splits to enclose the muscle. And below the pectoralis minor, the fascia, also known as the suspensory ligament of axilla, extends downward and is attached to the axillary fascia on the floor of the axilla. See here, this is pectoralis major. This is pectoral fascia. After that, here is the clavicle, subclavius, clavipectoral fascia, pectoralis minor, suspensory ligament of axilla, and here is the axillary fascia. Okay, and deep to the clavipectoral fascia, you can see these axillary vessels, axillary artery, axillary vein, and these are the cords of brachial plexus. 3 cords of brachial plexus lying around the axillary artery. And these are the back muscles. You can see this is section of scapula, supraspinatus, infraspinatus, subscapularis, trapezius. Here is a teres major, and this is latissimus dorsi. Okay, so this is a longitudinal section through the pectoral region. Understood the location of the clavipectoral fascia? Okay. So this is very frequently asked in Viva and OSPE. Okay. What structures piercing the clavipectoral fascia? Encloses clavipectoral fascia encloses subclavius and pectoralis minor, and it is pierced by lateral pectoral nerve, thoracoacromial artery, cephalic vein, lymph nodes, mainly the lymphatic vessels from pectoral region to the apical group of axillary lymph nodes. Here you can see the structures piercing lateral pectoral nerve, thoracoacromial artery, cephalic vein. Okay. So clavipectoral fascia is pierced by 4 structures. Passing inward are the lymphatics from infraclavicular nodes to the apical nodes of the axilla and the cephalic vein. They are entering through the fascia, and coming out, passing outward are the lateral pectoral nerve and the thoracoacromial artery and its branches, 4 branches: pectoral, acromial, deltoid, and clavicular. Okay. Okay, next we go to the incision line. For dissecting those clavipectoral region, what incision line you will see? First, vertical incision. Okay, this is vertical incision from the jugular notch. Jugular notch is present just above the manubrium sterni. This depression here is the jugular notch. Okay, from jugular notch up to the 4th costal cartilage. How will you determine 4th costal cartilage? After tracing downward from the jugular notch, you will see a prominent point, that is the sternal angle. Here lies the 2nd costal cartilage. After tracing downward, you will get the 3rd and 4th costal cartilage. So up to 4th costal cartilage, you have to draw a vertical incision. Then you have to draw 2 horizontal incision. One incision from the upper end of first incision along the clavicle up to the tip of acromion. You can trace along the bone up to the tip of the acromion where clavicle is joining with the scapula. And another is oblique incision from the 4th costal cartilage, oblique incision up to this first, up to the anterior axillary line. And this flap of skin will be reflected laterally and outward. Okay, so this is the skin incision. So I don't have to explain the skin incision there in the body. So you have understood? Okay. So what will we see there? Okay. After giving this incision, we are reflecting the skin. Okay. After the below the skin, you will see the superficial fascia. Within the superficial fascia, you will get some fat pad and the cutaneous nerves. You will see mainly the fat pad. Okay. And cutaneous nerve are very fine nerve that you will not see, and they are removed. After that, you will see the deep fascia. Okay, deep fascia is like whitish in color. It will cover the pectoralis major muscle, and this deep fascia is known as pectoral fascia. Okay, so under cover of this pectoral fascia, you will get the pectoralis major muscle. We have cut the pectoralis major muscle along its clavicular head, and some part of his sternocostal head we have cut. Okay. After that, we are reflecting the muscle downward and laterally. Okay. Next, you will see the subclavius muscle, clavipectoral fascia, pectoralis minor muscle. Okay. some part of the clavipectoral fossa has been cut to dissect out the structures piercing the clavipectoral fossa. The lateral pectoral nerve, thoracoacromial artery, its branches, and the cephalic vein you will see in the deltopectoral groove going to drain into the axillary vein, and also you will see the medial pectoral nerve. It is piercing through the pectoralis minor, entering into the pectoralis major. Okay, so all these structures you have to see there. Okay, so you will see the incision line. Okay, I will show you in two groups. Okay, Acha. You make a group of 30 people. Okay, how many rows are there?